Dr. Leo Powers. I'm a chiropractor in Plover, Wisconsin, and I've learned how to work on the cranium connected to the pelvis in the sacrooccipital technique. And today we're going to talk about cranial treatment for autism can be done easiest when the soft spots, or what they're called fontanelles, that's a scientific name for them, are still open. And there are 6 soft spots on the head. There's 2 here. This is the pterion and this is asterion, and then there's a pterion and asterion on this side, so there's 4, and then there's 2 on the top where the bones come together. Here, that's the anterior soft spot, and then that's the posterior fontanelle. And so there's 6. And so when you're born, these are all open on most people, and then within 1 to 2 weeks, the side ones, the 2 on the side and the 2 on the side here, close. And in some individuals, it may stay open, for a little bit for some reason. But and then the top one, this posterior fontanelle closes at about 2, and this one closes a little bit later. But the 2 one I think it coincides with baby teeth. You have 10 on the top, 10 on the bottom, and when they all come together, I think that's when this closes. And then the anterior fontanelle, that usually starts to close about the time that you get your permanent teeth, and then you get them on the bottom first and then on the top, and that ranges in age somewhere between 5 to 8, somewhere in there in individuals. And the important thing about that is that when the fontanelles are still open, and after 2, this one is still open for a few years, and so that's when the fontanelles are still open. The different cranial bones have room to move around a little bit, and the treatment is very gentle. The motion is about 2 to 3 millimeters, so there's 25 millimeters in an inch, and so it's just a small motion that you can do. And there's indicators to check to see what part of the head you need to work on. And the other thing with cranium is the maxilla, that's the upper mouth or teeth, this part up in here. This gets its full size when you're 12, whether you're a man or a woman or a boy or a girl. And then the jaw is called the mandible. That gets its full size, women at 21 and men at 26. And so the different cranial bones, it's easier to help people when you have more motion in the head itself. So autism cranial treatment can be done easiest when the soft spots or the fontanelles are open, and it can be helpful for children regaining their ability to talk and hear better. And over the years that I've learned how to do this, I've seen improvement in different areas related to talking, and sometimes it's hard to get them shut up once they start talking. So.